The DeVilbiss Preserve Tech MedAire Edge alternating pressure and low air loss mattress replacement system includes the mattress, choice of control units, and a machine washable cover. Safety is of primary importance. Prior to use, please review all warnings and cautions in the manual and watch this video in its entirety. Please be sure you understand the instructions before proceeding. Begin with the box on floor or another suitable stable surface. Unpack the box and inspect for any damage which may have occurred during shipment. If there is any damage, please contact your provider immediately. Next, check you received all the components: one mattress, one control unit and cord, a small plastic bag of extra air filters, a quick fill pump adapter, and an owner's manual. Note mattress components include an easy lock connector for setup, 3 inches of a foam base for power outage protection, a 4-way stretch quilt, Preserve Tech cover, 25-inch high air baffles or air cells, a 2-way all-around zipper with waterfall flap, and 6 securing straps. The basic control unit is complete as is and comes with a built-in 2-pronged power cord. The premium control unit, also complete as is, has a separate, easily replaced 2-prong power cord. The front of the control shows the setup and use controls, and the rear of the control unit has mounting brackets and a bumper. The power switch, the filter, and the power cord socket are on the right side when facing the bed. Now you're ready for the installation. It's quick and easy and no tools are needed. The Preserve Tech MedAire Edge mattress is a mattress replacement system and must not be installed on top of an existing mattress. First, place the mattress on top of the bed frame, noting the Preserve Tech MedAire Edge foot end. Please always make sure the width and length of the bed match the width and length of the mattress, because although there are no FDA entrapment guidelines for powered air or bariatric mattresses, entrapment concerns may still be relevant. In this example, we're installing a standard size MedAire Plus mattress, 36 inches wide by 80 inches long, on a standard sized bed also 36 inches wide and 80 inches long. Secure the mattress firmly to the bed frame by fixing all 6 straps and ensuring the moving and articulating sections of the bed are still free to move. Next, hang the control unit onto the bed footboard and adjust the hangers to the best upright position of the control unit. Do not place the control unit on the floor. Push the power cord into the power socket and plug it in. Connect the Easy Lock connector from the Preserve Tech MedAire Edge air mattress to the control unit. You'll know the connector is in the right position when a click sound is felt or heard. The control unit is only operable when the Easy Lock connector is connected to the system. Check and ensure all the air hoses are not kinked or tucked under mattress, and the CPR strap on the left side by the headboard is fully attached. That's it. Installation is done. Let's move on to operation. The Preserve Tech MedAire Edge system provides 2 therapies: alternating pressure and low air loss. These therapies are intended for prevention for those at high risk of skin breakdown and for treatment of all stages of pressure injuries. But beyond pure pressure management, the Preserve Tech MedAire Edge system gives caregivers a versatile tool indicated for a wide variety of your residents, because it also enhances resident comfort, compliance, sleep, ability to move in bed, and ingress and egress the bed. Before we get started on use and operation, let's look at the Preserve Tech MedAire Edge mattress and cover. Feel the soft, supple 4-way stretch cover. It's very home-like and comfortable to lay on. And it's manufactured with an antimicrobial agent called Preserve Tech to help minimize the growth of stain and odor-causing bacteria, algae, and mold. It's low shear and low friction, highly fluid resistant, moisture vapor permeable, easy to clean and maintain. You could even throw it in the wash if you'd like. Quilted in the base of our top cover is spun-bonded polyester fiberfill that exhibits less friction resistance to nylon than that of patient's skin. When a patient moves, the top sheet tends to move relative to the underlying cells rather than relative to the patient, minimizing shear strain. An additional benefit of our quilting is it provides a diffusion layer by which water vapor can be drawn away from the patient, resulting in more efficient evaporation, which leads to reduced skin maceration, a known pressure injury risk factor. Also, please note every edge has a built-in 3-inch lower safety foam base for resident transport and power failure. What makes the edge unique is its foam perimeter that easily articulates with every possible bed position. This unique foam edge fosters your patient's ability to manage his or her daily activities so they can get in and out of bed safely and complete self-care and mobility activities as independently as possible and, if feasible, return to a safe, active, and productive life in a community-based setting. Plus, the edge means there's virtually never any danger of side-of-mattress collapse during caregiving or patient movement. This mattress is 36 inches wide and 80 inches long and consists of 20 5-inch H individual air cells or baffles, which evenly distribute residents' weight and maximize pressure redistribution because the cell material conforms to the specific shape of every patient, minimizing soft tissue distortion and reducing bone and muscle friction. Every PreserveTech MedAire Edge air cell has 3 inches of foam underneath the air cells, guaranteeing power outage protection. And if ever needed, these air cells have quick disconnects offering convenient servicing or repair. The Edge mattress system has a 450-pound weight capacity and an 18-month bumper-to-bumper warranty. Okay, we're now ready to review how to operate the easy and intuitive, innovative, feature-rich dual therapy PreserveTech MedAire Edge. First, switch on the main power button found on the right side of the control unit while facing the bed. The PreserveTech MedAire Edge will beep once, the power switch will light up green, the low pressure light indicator will flicker red, and the PreserveTech MedAire Edge system will automatically go into auto firm mode for about 40 minutes to fully and automatically inflate. Quick fill pump will fully inflate the mattress in 2 minutes. Quick fill adapters are included with every MedAire Plus. When the initial inflation or auto firm process is completed, the PreserveTech MedAire Edge will automatically enter static mode. Using the patient's weight setting buttons, adjust according to the weight and height of the patient. Please note, due to different shapes and sizes of each resident or patient, these settings are only a guideline. And while the initial setting should be chosen based on resident or patient weight, comfort, and tolerance, it can be adjusted anytime. As the weight setting increases, the pressure level indicator lights up green with each added level of pressure. There are 8 available pressure levels, and the air pressure is regulated within each of these 20 air cells to ensure pressure redistribution and therapy are provided. If a patient prefers a firmer or softer mattress, increasing or decreasing the setting to ensure proper pressure redistribution, patient support, and comfort is correct practice. When a patient's condition has significantly changed, reassess the patient weight setting level. Now look at the top of the PreserveTech MedAire Edge's premium control unit as the advanced digital clinical features are reviewed. There are 2 therapy mode controls, making it easy to provide patient-centered, individualized care with this one mattress system. The first one I'm going to discuss is low air loss. The PreserveTech MedAire Edge systems uses a flow of air under the 4-way stretch cover to assist in managing the heat and humidity, also known as microclimate, of the skin. This therapy is constantly and consistently provided. Best practice dictates the fewer linens, and linens that do not block airflow or moisture vapor permeability of covers, like those we use on our PreserveTech MedAire Edge mattress, are best. However, DeVilbiss knows adult briefs and incontinence pads, if regularly changed and not full of wrinkles, enable caregivers to help control incontinence and maintain patient hygiene. So their use is not contraindicated on our PreserveTech MedAire Edge system, because even if low air loss is blocked by plastic or rubber, the patient can still get the benefits of pressure redistribution via the alternation provided by the PreserveTech MedAire Edge. The second therapy is alternating pressure. Engaging this button will provide pressure redistribution via cyclic changes in loading and unloading. There are 4 selectable cycle times available. Caregivers can select one of the 4 cycle times based upon patient comfort and desired outcome. With a choice of 4 cycle times, it's easy to customize and make virtually any resident tolerant of alternating pressure. Drive recommends always keeping the control unit in alternating mode for more effective pressure redistribution and enhanced pressure injury prevention and treatment. There will, however, be times when alternating needs to be paused. This feature comes in handy, for example, when you're doing wound care or giving a bed bath, your patient is eating a meal or getting in or out of bed. That's when you push the static button. At Drive, we understand caregiving is a hectic job, and with Drive's Preserve Tech MedAire Edge, there's never a worry if static is inadvertently left on. Because the Preserve Tech MedAire Edge will automatically and always revert back to alternation in 2 hours, helping assure every patient on a Preserve Tech MedAire Edge meets the gold standard of movement in bed at least every 2 hours. The Preserve Tech MedAire Edge has additional features benefiting both caregivers and patients I'd like to now demonstrate. When the head of bed is elevated 30 degrees or higher, we recommend engaging seat inflate to prevent possible bottoming out and to provide additional support to the patient during head raised or Fowler position. The seat inflate button can remain on indefinitely if desired. One of the most useful features is auto-firm. When pushed, the entire mattress fully and rapidly inflates, bringing the patient to the very top of the mattress. Although no longer therapeutically redistributing pressure, auto-firm makes it very easy to change linens, turn, reposition, provide care, pull up even very heavy patients, and assist them ingressing or egressing the bed because it's easier to get in or out from a firm surface than a soft one. And no worries about the non-therapeutic pressure redistribution because the MedAire Plus will always automatically return to therapeutic settings in 20 minutes. There's a lock button too. If the control unit panel remains untouched for 3 seconds, the panel lockout feature will lock the in settings as they are, and the green LED light will display. This feature helps prevent accidental or unintentional setting changes. To unlock, simply press the lock button for 3 seconds. In the event CPR compressions need to be performed, best practice is releasing the easy lock from the control unit and pulling the red CPR located near the head before beginning compressions. Sometimes things go wrong, and an alarm will sound and illuminate. There's a mute button so you don't have to listen to the alarm while you troubleshoot. And troubleshooting with the Preserve Tech MedAire Edge system is very easy. A low-pressure LED indicator will light up and the low-pressure alarm will activate if the Easy Lock connector becomes disconnected. Once the low-pressure problem is resolved, the control unit will resume operation in the previously set mode. The power failure alarm will light up and sound if there's a power outage. When power is restored, the control unit will resume operation in the previously set mode. And remember, there's 3 inches of foam under the air baffles, so even in the event of a prolonged power outage, the patient is resting on foam, never on a bed frame. The third alarm, system failure, means there's something wrong with the control unit and it'll need replacing. Rest assured, Drive DeVilbiss quality, manufacture, design, and final product testing are very rigorous, so these alarms will rarely sound. That's all there is to it. Enjoy the many features and benefits of Drive DeVilbiss's Preserve Tech MedAire Edge mattress replacement system. And please, never hesitate to reach out with any questions or concerns. Drive's Preserve Tech MedAire Edge basic analog control unit includes an easy-to-use pressure dial that is adjustable to the patient's weight and comfort, a static button to discontinue alternation therapy for patient transfers, caregiving, comfort, or preference, low pressure and normal pressure indicators with a corresponding mute button to silence the low pressure alarm. Maintenance. Your facility owns Drive DeVilbiss's Preserve Tech MedAire Edge mattress replacement systems, which are designed and intended to offer safe and reliable therapy when installed, operated, cleaned, and maintained according to the instructions provided by Drive Medical. If the following simple, quick, and easy maintenance tips are followed, service of the Preserve Tech MedAire Edge shouldn't be required. Check the main power cord and plug for abrasions or excessive wear. Check the mattress cover for signs of wear or damage. Ensure the mattress cover is securely on and the tubes are connected correctly. Check the air hosers for any kinks or breaks. Inspect the air filter, located on the right side of the control unit, every 1 to 2 months. Do not wash and reuse. Every Preserve Tech MedAire Edge is shipped with 3 extra replacement air filters. Now onto cleaning your Preserve Tech MedAire Edge system. For general cleaning, for example, when the mattress is in use for the same resident, simply wipe it down with a damp cloth pre-soaked with warm water containing a mild detergent, 1 to 10 chlorine bleach, or a quaternary cleanser. If needed, the Preserve Tech MedAire Edge's mattress top cover can be completely removed and laundered. Please keep the water temperature below 96 degrees Fahrenheit and allow the cover to air dry before zipping it back onto the mattress. For terminal cleaning between residents or when an infectious contagion has been in contact with the Preserve Tech MedAire Edge, disconnect all the individual mattress air bladders or cells from both sides of the mattress and spray each one on all sides liberally with a disinfectant and allow the cleanser to set in or dwell for the detergent manufacturer's recommended time. Allow the cells to air dry, then replace. Simple, easy, quick. Drive DeVilbiss clinical, sales, and technical customer service is always ready to assist. Please never hesitate to reach out with any questions or concerns. Drive DeVilbiss for the road ahead.